Now, according to the United Nations, an estimate of around 385,000 babies are born every day around the world, which makes it 140 million babies a year. And this number will remain relatively stable in the 50 years from 2020 to 2070. However, in Africa especially, the stark reality is that the potential loss of thousands of children in a single day still looms large. So it's not about having more children born in a day. It's about maintaining the number of these children. It's about maintaining their health and their lifespan. And this is due to the prevalence of chronic illnesses, diseases, and even seemingly minor ailments that often go undetected. And this leads to a tragically high rate of child mortality. Now, the root of this issue can be traced back to inadequate resources and healthcare infrastructure in many African nations. Now, efforts are being made by the government and, of course, non-profit organizations, as well as healthcare practitioners and, health workers at large. As a matter of fact, the Pan-Conf 2024 is an upcoming event, for example, that will also serve as a platform to address the critical topic of children's health and explore strategies for safeguarding the nation's most precious assets, which are our children. Now, that said, I will now be joined by two gentlemen who will help us further understand the risks associated with not solving this problem right now and, the potential crisis that we may be facing when it comes to children's health. I'm joined first in the studio by Dr. Chris Esezobor, Professor of Pediatrics and Nephrology College of Medicine, UNILAG. Thank you so much, Dr. Chris, for joining us.
Thank you, Blessings, for having me.
It's a pleasure. We also have with us in the studio Mr. Olaseinde Babatunde Eletu, the CEO of Marina Medical Services. Thank you so much, Mr. Babatunde, for joining us as well.
Thank you very much. Nice to be here.
It's a pleasure. Now, I will start with you, Dr. Chris. You are also the chairman of the local organizing committee for the Pan-Conf that is coming up in 2024. Can you tell us about that and what that event aims to achieve when it comes to children's health and helping these children, basically stay alive?
Yes, so I'm going to be sacked very soon because the chair is Dr. Olaseinde Eletu. I'm the chair of the scientific subcommittee.
All right, apologies.
But I'm happy to have that role, even if it's just for 1 hour.
I take that back so you can keep your job.
So thank you very much. I'll just put in a word and then the chairman will talk about it.
All right, please go ahead.
And so Pan-Conf, meaning Pediatric Association of Nigeria Conference 2024, will take place in Lagos. It is the flagship scientific event of the Pediatric Association of Nigeria. This will be the 55th annual Pan-Conf of the association, founded in 1969. Pan, the association, is the #1 premier professional association for pediatricians and healthcare specialists allied to the care of children. And so every year, we meet in a scientific meeting to address pressing issues. And your introduction cannot be more apt. We're giving birth to a lot of children in this part of the world. For instance, in Nigeria, the average fertility is about 5 for every family. But we're losing most of them. We're losing most of the children. So we are essentially not only the poverty capital of the world, but we're essentially in terms of mortality, the capital of the world when it comes to children. And like you rightly stated, yes, these children are being given birth to, but most of them die. So for instance, for every 1,000 children born today, over 100, about 115 or so, will not see their 5th birthday. That's the reality we have in Nigeria. In contrast, a country like Afghanistan, only 50-something will not see their 5th birthday. That means half the number of Nigerians that will not see their 5th birthday is what is happening in Afghanistan, is what is happening in Yemen. Even our neighbor just up, Niger, fewer children or more children are seeing their 5th birthday compared to here in Nigeria. And so that automatically brings up, is there inadequate resources? Is there a skewness in how we allocate resources? Or is there something fundamentally wrong? And that's what Pan-Conf would like to address. Pan-Conf would like to uplift to the stage that the health of our nation's most valuable asset, that's our children, doesn't only lie in the hands of the doctors, the hands of the nurses, in the hands of those that work entirely in the hospital. It depends on what the government does. It depends on what the society does. It depends on how our resources are allocated. We will be using Pan-Conf 2024 to address these issues in greater details. For instance, we are getting UNICEF to come talk to us about the state of the Nigerian children. Yes, we often hear the state of the nation. We'll be using this opportunity to highlight the state of Nigerian children.
All right. Thank you so much for that, Dr. Chris. And, well, like I said, we made the correction so you can still keep your job. But in the meantime, Mr. Olaseinde Babatunde, could you please do us the honors of speaking more about what Dr. Chris just said?
Okay, well, thank you very much. Thank you, Chris, for setting the tone. I think also Pan-Conf also 2024 will also be addressing other issues apart from just reaching every child. We're also looking at the adolescents. I mean, we know that there's a high prevalence of addiction amongst the adolescents. And we're not talking just about drug addiction. We're talking about gambling and betting. We're talking about pornography. We're talking about other issues that the adolescents are engaging in that we know that are very risky. We're also looking at safeguarding children generally. I mean, our children are at home or in school. We're at work. We don't know what they are really doing. How many of them go to some sites on the internet that they're not supposed to go to? What are the things that they pick up from the society that is obviously detrimental to their health? So Pan-Conf will be addressing all of these issues. And we also have quite a lot of intellectuals that we've invited to come have a discussion with us. For instance, General Marwa of NDLA has agreed to come talk to us about addiction among the adolescents, because we know that's one area that he has a passion for. We also have international speakers who are coming in to also talk to us. The International Pediatric Association president is also coming into Nigeria, and he'll be attending this conference. So we know that it's not just pediatricians alone, but we need other people who can also support what the government is doing and also help. We're also going to invite some parents also to come and share their experiences with us, because one thing is for the doctor to be there to treat, but the children usually stay with the parents at home. So we need the parents also to come share some of their thoughts and some of their challenges with us so that we can find a common path forward. Thank you very much.
All right. Thank you for that. Now, let me come back to Dr. Chris. What would we say are the most common reasons why we have child mortality? Why do we have so many children suffering these ailments, especially some diseases that could easily be detectable, but a lot of them go undetected and have fatal consequences on these children? Why is that?
I think you used the correct adjective, preventable. The most common causes of death in our children are largely preventable from simple, low-cost measures. For instance, almost 30% of deaths among children, under 5 children, happen in the first month of life. A big chunk of that death happens in the first 7 days. And a big chunk of the death that happens in the first 7 days is actually happening within a day or 2 of delivery, meaning that the health of the newborn is closely tied to the health of the mother. If the mother is unhealthy going into pregnancy or becomes unhealthy during pregnancy, then the chances that the child, even though the child comes out alive, will be at risk of dying too soon is very high. And so why are our children dying in the first month of life? Our children are dying in the first month of life largely because they are born too early, they are born with very low birth weight, or when they gave birth to them, they did not cry at birth, meaning that they were unable to initiate breathing on their own, or because they ended up with an infection, or because the mother had some chronic illnesses undetected in pregnancy, and that led to an adverse outcome. Let me put it in a practical sense. We have many children that just only required a few bag and mask ventilation to get air into their lungs soon after birth for them to be fine. But many of our children don't get that. Why? Most of the deliveries don't take place under a skilled health manpower. A lot of our mothers are delivering in places other than the hospital, other than the health facilities, even when those facilities are there. For several reasons, they either choose to deliver where this manpower is not needed. A lot of our mothers, when they are pregnant, do not get any supervised health care. And so simple febrile illnesses may make them to deliver too soon. And once the baby comes out too soon, that's a big problem. Jaundice is another problem, which is the yellowness of the eyes, very common in the newborn. A lot of our mothers, because they are not delivering in the hospital, because they are not coming, they won't recognize that yellowness of the eyes. And it is particularly dangerous because damage to the brain, lasting damage to the brain, could occur within 3-4 days of birth. And such that even if the child survives, the child is starting life at a significant disadvantage. If you leave the first month of life, our children are dying mostly from malaria, just limiting it to Nigeria. Malaria is a big cause of mortality. Yes, as a world and as a country, we've made modest progress in what we call rolling back the scourge of malaria, but we still have a lot more to do. Our children are not sleeping under insecticide-treated net. We all know some of the reasons given. The weather is too hot, there is no electricity. Again, that goes to the fact that it takes more than the doctors, it takes more than those that work directly in the health sector to significantly affect the life of our children. Our children are dying from pneumonia. Pneumonia, what we call chest infection. A lot of parents think it's due to cold air, cold water, or an air-conditioned room. Certainly not. It is due to germs. And a big chunk or significant number of these germs are covered by vaccines. Nigeria, as a country, we are lucky that the government is able to provide these vaccines. But we still have regions, places around, even here in Lagos, that a 1-year-old child has not received one vaccine, even though those vaccines are freely available and provided for by the government. Pan-Conf will be exploring those issues we call the zero-dose child and trying to find out why we are not getting it. And we are happy to say the executive secretary, the head of the National Primary Healthcare Development Agency, has agreed to attend Pan-Conf and to speaking during one of our sessions. Malaria is still a big issue. Diarrhea is a big issue, even though we've made a lot of progress with diarrhea. And I want to use this opportunity to say mothers should stock in their houses what we call oral rehydration solution, so that when a child starts stooling and vomiting, that is the first thing to give. It's not to start giving medications, antibiotic. If a child is stooling and vomiting, oral rehydration solution. At Pan-Conf, we will be addressing these low-cost, high-impact interventions that we are not taking the best advantage of. I cited Afghanistan and Yemen really to say that despite the fact that their GDP per capita is half, sometimes 1/3 of Nigeria, in terms of how their children are faring, they are doing far better than us, and we need to do better.
Indeed, we do need to do better. Now, Mr. Babatunde, one word that we've used a lot in the course of this conversation is the word detect. We find out that some of these diseases and illnesses, which end up being fatal for the children, are easily detectable but yet go undetected. So in your opinion, Mr. Babatunde, what are the primary obstacles that prevent the early detection and treatment of pediatric illnesses, especially in resource-limited settings, and what are the solutions to that?
Okay, thank you very much. I think the first thing to think about is education. Education is extremely important, and not just for the child, but for the caregivers, particularly the parents. I mean, if a mother, for instance, knows that if my child has a fever a high temperature, and I don't do anything about it, that child is likely to convulse. And from convulsions, you can have other complications. Then you know that education is extremely important. Education is also important if a mother knows that she needs to attend antenatal care, just like Chris said earlier. I mean, most of these issues that we were looking at, if the mother had proper antenatal care, she would obviously more likely give birth to a child that is healthier and, of course, have a higher chance of survival. Like I said, the first day of life, I consider to be the most dangerous day in the life of any child. If you survive that day, your chances of survival is much higher. So we need to have our mothers educated. The fathers also play a very important role. I mean, even if you have little amount of resources, how are those resources allocated? The father eats the biggest piece of meat in the house, whereas he probably doesn't even need to eat the meat. And the child that is still growing, that needs all the vitamins and all the minerals and the protein, is not given anything. So education, for me, plays a very important role. And access to care also is very important. Why access to care is important is, where are these facilities located? How easy is it for parents to get their children to these locations? Do the parents even know what it means to have a child vaccinated? We've just heard about the epidemic of diphtheria, particularly in the northern part of the country. All that child needed to have had is immunization at the age of 6 weeks, 10 weeks, and 14 weeks, and possibly a booster much later on. And we will not see diphtheria as a problem. This was something that we thought we had eradicated initially, but it's so difficult to understand that in 2023, we're seeing children coming down with diphtheria. Obviously, that education has not permeated. Government also needs to do a lot of health education. We need to let the parents know what is happening, what we can do to easily solve the problem. The religious bodies also play a very important role. I mean, we've had some people talking about children not being vaccinated. For instance, we have the HPV, the vaccine against cervical cancer. And you hear all sorts of stories, oh, they're trying to make sure our children don't get pregnant if we vaccinate them. No, this is not true. So government also needs to play a very important role in educating our people before they roll out such vaccine that is very important and life-saving. We need to know that, look, our people will obviously oppose, some people will obviously oppose this, but we need to let them know the advantages of having this vaccine so that 50 years down the line, that girl that you vaccinated today will not develop cervical cancer later on just because a vaccine that is freely available was not administered to the child. Thank you.
All right. Thank you for that, Mr. Babatunde. Now, in terms of treatment, and I'm going to come back to you, Dr. Chris. In terms of the treatment now, we've talked about these diseases and illnesses being detected. But what role do you believe that technology and innovation can play when it comes to improving pediatric care, particularly in underserved communities?
I think we can quantify the benefits we stand to derive from technology, more so in our own country. Every day you read in the news, hospitals can't find doctors, hospitals can't find nurses, hospitals can't find other healthcare workers. And that's hospitals. If you go to rural areas, semi-urban areas, they will tell you that their healthcare practitioner has internally migrated to the city. If you move to some parts of Nigeria, they will tell you that their health practitioner has moved to Lagos, Abuja, Port Harcourt, or some other cities. So even internally, our healthcare manpower is skewed in distribution, leaving a big chunk of the society unserved. And so we cannot underestimate the role that technology would play. During Pan-Conf 2024, we have a symposium titled Reaching Every Child in Nigeria with Optimal Care, looking at IT and finance as enablers. And that is a recognition that we need to start embracing technologies, information technology, to deploy healthcare. We can't always be there. The manpower cannot all, saying that you can't even have your boots on the ground everywhere. Technology will help us to be able to improve. And technology includes mobile phone. It doesn't necessarily have to be something high-tech. It may just be a mobile phone, a text message reminder that, Mom, you need to come for your child's immunization. We haven't seen you. Or, Mom, you need to come for your antenatal care. So definitely technology will. You talked about access. You asked Dr. Eletu about access. He talked about education, ignorance as a roadblock. We can't shy away from the fact that finance is a roadblock. Yes, for some people that have conquered the ignorance and they want to access care, finance is a big hurdle. We currently, in most parts of the country, run a healthcare service on a pay-for-service. And most times it's actually fee-before-service model we are running. And most of this payment for healthcare is out of pocket. And because they are unplanned, they are huge. They could result in significant, or what we call catastrophic burden to family incomes. And that brings us next to what is the government doing? And for Nigeria, for instance, we have the National Health Insurance Scheme, probably more than 20 years since it came on board. How big is its influence? What have they been able to do over this period of time? And in the last 2 governments ago, the National Health Act was passed, and a fund was set aside for what we call basic health care. How operational is that fund? Are Nigerians already benefiting from it? These are some of the burning questions we would like to address during Pan-Conf. And we are attracting people in authority that could speak to those topics during Pan-Conf.
Right. Now, Dr. Eletu, we've talked about so many different measures over the years when it comes to improving the health care of children, and ensuring that they get the optimal treatment that there is. But of all these measures that we have discussed, what initiatives or programs or measures have shown the most promising results when it comes to reducing child mortality and improving the overall pediatric health outcomes in African countries?
Yeah, thank you very much. I think, like we said, if we look at the infant mortality rate and the neonatal mortality rate, we know that the first day of life is the most difficult for any child. And if we therefore educate the mothers and get them to have proper antenatal care, that has shown to reduce infant mortality. The other thing we've also done a lot with in Nigeria will be things like oral radiation therapy that started much back in the 80s, and get our mothers to continue to do that. That will obviously reduce the number of children that would die from diarrheal diseases. Immunization plays a very significant role, and we know that the uptake in Nigeria has gone up slightly better than, say, 5 years ago, because we know that pneumonias, for instance, will be one of the major causes of death in children. So if we get them to have their vaccinations, we can also prevent that. Chris talked about access in terms of funding. The National Health Insurance Agency, I would say, has done quite a bit of work also. For those who already access care under that scheme, if the statistics that are available to me is correct, most of those children have a higher or a better chance of survival compared to parents who don't even have any form of insurance at all. Because if a father has to sell everything he has or sell a house to look after a child, you can imagine what will happen to the children, the other children, if that child survives. So health insurance also will play, has been shown to play a very active role or good role in making sure that our children survive. But we can't still shy away from the fact that education is still extremely important, not only just for the child, for the parents as well, but for the general population, because sometimes some of our children are not with us and they're with other people. And if they don't know what the danger signs in children are, obviously they will miss it. And by the time the child gets to the hospital, it may be too late. So education has been shown to play active roles. In fact, for most countries where they have very low infant mortality, education is a major criteria in terms of getting those children healthy. So we still need our government to play more roles, educating our people, and of course, vaccination, oral radiation therapy, getting the children to sleep under mosquito nets, because malaria is also a common, a major factor in mortality amongst children. So these are things that we know over the years have been shown to reduce infant mortality, and we want to make sure that we get people educated to know more about this, and then we'll see how we can further reduce infant mortality rates in Nigeria. Thank you.
Right. Okay, thank you so much for that insight, Dr. Eletu, as well as Dr. Esezobor. Now, we're not done yet with the conversation, but we'll go on a short break. When we come back, we'll continue talking about pediatric care and what can be done to improve child health, especially in the African continent. Do stay with us. Many thanks for staying with us on the program. Now, the prevalence of child mortality in Africa is a complex issue rooted in a multitude of factors that include poverty, lack of access to healthcare, and limited education on preventive measures. Now, pediatricians at the forefront of this crisis are working tirelessly to address these challenges and develop innovative strategies to combat the high rate of child mortality in the region. And that's why you hear us talking about things like Pan-Conf 2024. Now, I still have my guests with me in the studio. First, Dr. Chris Esezobor, Professor of Paediatrics and Nephrology, College of Medicine at UNILAG. Thank you for staying with us, Dr. Esezobor.
Thank you, blessings.
My pleasure. We also have Dr. Olaseinde Babatunde Eletu, the CEO of Marina Medical Services. Thank you, Dr. Eletu, for still being with us.
Thank you very much.
A pleasure. Now, Dr. Eletu, I'm going to come to you very quickly. Still talking about the Pan-Conf 2024, using that as an example. I think the question will be, how can we foster collaboration and knowledge sharing? Now, we've talked about how to create awareness, for parents of the children, for getting tested, for getting vaccinated. But now, amongst the healthcare professionals and healthcare workers, how can we collaborate and, foster knowledge sharing, as well as with organizations to enhance pediatric care on a global scale?
Okay, thank you very much. This is one of the objectives of Pan-Conf 2024, where we have not just the pediatricians alone talking to one another. We're bringing in other experts who are not necessarily pediatricians. We have our pediatric nurses who are also joining us in making presentations and in these discussions. We have international agencies also who are coming to join us. Like I said, the International Pediatric Association president is coming in to also share knowledge on the global scale, what they're saying. We have NGOs who are coming to talk to us. We have the NAFDAC DG we're expecting to come and share knowledge with us as to how do we make our children, how do we make drugs safer for our children. We have pharmaceutical companies who are also coming to share knowledge with us. We have lawyers who are coming to talk to us about issues to do with addiction, child safety at home, in school, and all of that. So it's not just the pediatricians alone who can solve this problem. We also, like I said, we have parents who are also coming to share knowledge. So for us to have effective care for the child, we need everybody. And like the saying goes, it takes a village to raise a child. So, and that village is made up of everybody that is involved in child care. Thank you very much.
Right. Thank you so much for that. Now, Dr. Esezobor, when we're talking about raising awareness, a lot of times people in underdeveloped areas, underserved areas, most of the time, this is not exactly their problem. When you find it hard to even feed yourself and your families, you would hardly think about getting your children vaccinated or trying to check their health to make sure that everything is intact. So how do we ensure that these people get, because it's not just about creating awareness now, how do we ensure that they have optimal understanding of what the risks are if they do not get the best care for their children? How do we make sure that that information reaches even the deepest part of these areas?
Thank you very much. We're at News Central today because of that very important need. The pediatricians alone can't reach them. We need everybody collaborating, pulling together in the same direction to make sure that, one, in terms of awareness, everybody is being reached. We are not experts in getting everybody reached with information. journalists like you, media houses like News Central, that is what they do. And our visit here today, and you having us, is a recognition of the fact that we need to collaborate to co-create platforms, interventions, to pull resources together to help us to achieve our primary goal. We have the same goals when it comes to these children. We want them to be healthier, to be more successful. And we can't do it alone. So if you take most issues that really affect children, and not just children, the health of an individual is well beyond just medicine. Well beyond the type of house you live. Do you have potable water, clean drinking water? How do you dispose sewage, for instance, your sewage? They're not necessarily in the realm of the doctors, in the realm of the hospitals, but they are well within the purview of various aspects of government. And if all of us are making sure that those boxes are being ticked, it will make a huge difference in the outcome, the health of these children. We already talked about finance. We talked about IT in all this. The doctors are not experts in this. And like Dr. Eletu said, for a lot of these issues during Pan-Conf, we will be sharing knowledge. We will be exposing even pediatricians to things they normally don't do. For instance, how do we keep our children safe on the online expressway? The pediatrician doesn't have, the all say on this. We have IT experts, people that do this for a living. We will be engaging them. We will be giving them an opportunity, not only to teach us, the pediatricians, but also to educate the public how we can keep our children safe. So we need everybody acting together. I think that's the message.
All right, thank you so much for that, Dr. Esezobor. Now, back to you, Dr. Eletu. When we're looking at the Sustainable Development Goals, for example, SDG number 3 talks about good health and well-being. I think that's the one that captures child health. So looking ahead, what do you envision as the key milestones and the advancements when it comes to pediatric care over the next decade? Where do we reach as a continent that we say that we have actually reached the goal that we have set under the SDG number 3?
Okay, well, I think the most critical for me will be that we reduce mortality rates, both infant and neonatal, to 0 if it is possible. If we can do that, then we'll have done a lot. Talking about potable drinking water, can we have access to water all over the continent of Africa for every child? Can we have education accessible to every child in Africa? If we do a lot of this, nutrition, what are we doing about nutrition? Is it possible to reduce the malnutrition rate to almost 0? If we can do this, we obviously will have done more than what we have set, the goals we've set for ourselves. But that, of course, also requires a lot of education, a lot of infrastructural improvement in services delivered by government. Also, we need people out of government who have the financial muscles to help us achieve these milestones. Thank you very much.
All right. Finally, Dr. Esezobor, in terms of the Pan-Conf 2024, what are you looking forward to generally? What do you hope that that event will achieve? I know that we've mentioned a lot of things that we're going to be focusing on at the event, but what do you generally hope that it achieves?
So we want to make it a memorable event. Memorable event because we want to use Pan-Conf 2024 as a platform for us who want to examine what we have been doing. You asked about what are the advances we need to do to make sure that we meet SDGs. The truth about it is that most of the things we need to do are already known. If mothers, when they are pregnant, are getting supervised manpower at their supervised delivery by skilled manpower at their delivery, if our children are getting the vaccines that government provides free of costs in Nigeria, if we have access to potable water, if our children are sleeping under insecticide-treated net, if our children are getting the vaccines they need to get, if we're keeping addiction away from our children, we will be meeting these goals. However, the current reality is that if we don't do something urgent to scale up coverage of these beneficial health interventions, Nigeria would not meet the SDG goals in terms of child mortality or child well-being. And if Nigeria is not meeting it, you can as well be sure that Africa will not meet it. And if Africa is not meeting it, it's likely that the world will not be able to meet it. So all hands are on deck. And that's why we're getting UNICEF, we're getting the WHO to come participate in our meeting. We're getting the International Pediatric Association President, Dr. Navin Taka, to come join us. We're getting governments, those in the position of power. We're getting the Director General of NCDC, like I said, the National Primary Healthcare Development Agency. We're speaking with NAFDAC. We're speaking with everybody that we know that if we sit together in the same room, rub minds together, then we'll come up with how we scale up. The problem is scaling up these effective, low-cost interventions. Just if you compare the under 5 mortality in some parts of Nigeria, for instance, Lagos, to another part, there's a huge gulf.
Right. Right. Okay, on this note, I would have loved for us to continue talking about this because this is a topic that we cannot exactly exhaust in one sitting. But I would say that we're looking forward to the Pan-Conf 2024 event, and we really do hope that the purposes of that event is achieved. And at the same time, child health is prioritized, and something is done about increasing child health, especially in this part of the continent. Thank you so much, gentlemen. Dr. Chris Esezobor, Professor of Pediatrics and Nephrology, College of Medicine, UNILAG, as well as Dr. Olaseinde Babatunde Eletu, the CEO of Marina Medical Services. Thank you, gentlemen, for joining us to discuss this very crucial matter on the show.
Thank you very much.
Thank you, Blessing.
My pleasure.